Our final topic for Chapter 5 is skin cancers. Now, recall that at a basic level, cancer is a condition in which a cell undergoes essentially uncontrolled or unchecked cell mitosis. Skin cancer is the most common type of cancer because the integumentary system is the most superficial of all the organ systems, so it's the most exposed. But it's also the most common type of cancer because the important risk factor in skin cancer is ultraviolet light exposure from sunlight or from tanning beds. And so because our skin is our most superficial organ system, and because UV light is the primary cause of skin cancer, this sets up a really good recipe for allowing skin cancer to become the most common type of cancer. We're going to take a look at three major forms of skin cancer. We're going to take a look at basal cell carcinoma, squamous cell carcinoma, and melanoma. So we'll go in that order there. Basal cell carcinoma is the most common of the skin cancers, so roughly 80% of skin cancers are basal cell carcinoma. It is the least malignant of the skin cancers. That is, it tends to be a very slow-growing cancer. It doesn't metastasize very easily, so remember, metastasis is the ability of the cancer to spread to different places in the body and spread to other organs and organ systems. So basal cell carcinoma really doesn't do that. It tends to not metastasize very easily, and so it tends to stay put, which makes it really easy to cure. Even though it's the most common type, it's fairly easy to cure. Basal cell carcinoma tends to arise from cells in the stratum basale that then invade the dermis and underlying connective tissue layers. Unsurprisingly, as I mentioned in the first slide on skin cancers, UV light is the primary risk factor for determining skin cancers, and unsurprisingly, basal cell carcinoma typically occurs on sun-exposed areas of the skin, so it tends to be the face, the back of the neck, and things like that. Because basal cell carcinoma tends to not metastasize very easily and is very slow growing, it's very easy to cure it by simply surgically removing the affected area, and that typically will cure the patient. Squamous cell carcinoma is the second most common type of skin cancer. It tends to grow a little bit more rapidly and has the ability to metastasize at a much greater rate, or has a much easier time metastasizing than basal cell carcinoma does. It tends to arise from keratinocytes of the stratum spinosum, and just like basal cell carcinoma, it occurs most commonly on sun-exposed areas of skin, so face, scalp, back of the neck, that kind of thing. This tends to also be treated fairly easily by surgical removal, but also radiation therapy might be necessary if the cancer has metastasized. And finally, we wrap up our discussion of skin cancers with melanoma. Melanoma is the most rare of the or one of the more rare forms of skin cancer, as it accounts for only about 1% of skin cancer cases. It is named melanoma because it is a cancer of the melanocytes. A characteristic of this cancer, other than its appearance, it has its appearance of kind of brownish, very, very unusual looking brown or black spots on the skin, is that melanoma tends to metastasize very quickly, and it's also very resistant to chemotherapy. So by the time it's discovered, it's probably already metastasized, and so surgical removal can remove the initial tumor, but other tumors may exist in other locations, and chemotherapy has a hard time destroying them. Melanoma doesn't necessarily have to occur in places where there is or in places where there is a lot of sun exposure. So essentially, melanoma can set up shop basically anywhere where there is skin pigment. It can even arise from pre-existing moles, and so it can pop up in places that are not very heavily exposed to sun, and so it's sometimes very easy to miss melanoma tumors that are starting to grow in places, especially that that are not frequently exposed to sunlight.